When most people think of heart attacks, they picture arteries slowly clogging with cholesterol plaque. But the data reveals a different problem. 80 to 90% of heart attacks and over 90% of strokes are the direct result of blood clots. This animated diagram shows why that distinction matters. On the left is a normal blood clot, your body's survival mechanism to stop bleeding, which dissolves safely within minutes or hours. On the right, you see what happens during a stroke or heart attack. The clotting process becomes dysfunctional, creating dense, matted strings of protein that harden and refuse to dissolve. This transformation into a hardened mass is triggered by the presence of endotoxins, microscopic pieces of the outer walls of bacteria. These toxins are released when dormant microbes in your bloodstream find an environment with excess free iron. They wake up and thrive, releasing the chemical signals that fuse the clot into an immovable structure. To protect yourself, you need to change your biochemical environment. Today, we are going to build a very specific meal, paired with a targeted physical routine, engineered to starve these microbes and bind up that dangerous free iron. Preventing a fatal cardiac event requires a tactical defense against these pathogens and their iron triggers. Simply lowering your cholesterol and avoiding saturated fats will not address the root of the problem. Step 1 is choosing the right protein base for the meal. We are using wild-caught salmon. It gives us high-quality protein, but with significantly lower iron levels compared to beef or pork. Salmon also provides a high concentration of omega-3 fatty acids. This specific fat profile actively thins the blood and reduces inflammation inside the artery walls. But there is a strict rule you must follow here to avoid the iron trap. Do not substitute the salmon for red meat, and never cook this meal in a cast iron skillet. We have to tightly control iron intake because excess free iron acts as direct fuel for those pathogenic microbes. The more iron they consume, the faster they multiply, and the more endotoxins they release to tangle your blood. Controlling your iron exposure right from the cooking stage is the non-negotiable first layer of defense in this protocol. Next, we built the salad to pair with the salmon. The base of the salad consists entirely of arugula topped with sliced beets. Arugula and beets hold the top spots as the highest dietary sources of nitric oxide. Nitric oxide is a chemical compound that dilates blood vessels, lowers your blood pressure, and actively prevents clots from forming. For the dressing, you will need exactly 3 components: extra virgin olive oil, apple cider vinegar, and fresh garlic. Each ingredient serves a distinct chemical purpose. The olive oil is rich in polyphenols, which bind to any excess iron and neutralize it. The apple cider vinegar tightens and seals leaky tissues in your gut, preventing endotoxins from escaping into your bloodstream. Finally, the fresh garlic acts as an active anti-pathogenic remedy. To complete the plate, add exactly 1/4 cup of sauerkraut as a side dish. This animated diagram illustrates how the sauerkraut works inside your digestive tract. The fermented cabbage provides lactic acid bacteria, which lock onto the jagged endotoxin particles and neutralize them before they can enter your bloodstream and trigger abnormal clotting. By combining raw, high-nitrate vegetables, fermented cabbage, and an acidic polyphenol-rich dressing, you create a chemical shield that blocks the specific mechanisms driving clot formation. To finish the meal, you will pair a cup of green or black tea with a small piece of 85 to 90% dark chocolate. Both the tea and the dark chocolate deliver a final dose of polyphenols to bind up any remaining free iron in your system. The dark chocolate also delivers a concentrated amount of magnesium, which helps regulate your heart's electrical rhythms. The meal gives you the chemical tools, but you have to activate them. As soon as you finish eating, go outside for a 10 to 20-minute brisk walk. There is a strict biological requirement for this walk. You must keep your mouth closed and breathe exclusively through your nose the entire time. Maintain a steady pace while focusing entirely on deliberate, continuous inhalation and exhalation directly through your nasal passages. This specific combination of physical exercise and nasal breathing triggers a massive spike in oxygen and nitric oxide production. This physiological reaction actively works to dissolve existing clots and stabilize your blood sugar. The food establishes the biochemical environment you need, but the physical movement and nasal breathing act as the catalyst to fully execute your defense against clotting. You now have the complete protocol: a low iron protein base, gut-sealing acids, microbe-neutralizing ferments, and nitric oxide-boosting movement. Following these exact steps starves the dangerous microbes hiding in your system and stops abnormal, hardened clots from taking shape. Earlier, we mentioned adding dark chocolate to secure magnesium. We did that because controlling calcium and magnesium levels is critical for preventing fatal arrhythmias. To fully understand how magnesium functions as the primary electrical stabilizer for your newly protected cardiovascular system, click this video right here.